Something else nobody really talked about, and I've gotten some of this in the comments, is around healthcare. Nobody told me, healthcare would be this big of a piece of the puzzle. It's not just about paying for it, it's about navigating the plans, the hidden costs, and the stress of making sure that you're covered. My wife and I are fortunate that we had employers that allowed us to stay on the group plan. So we are able to continue to navigate in ways that we were familiar with. But for a lot of us, let's say you step out and a lot of early retirees go on the ACA plans, which are the Affordable Care Act plans, as a way to continue care because it's one of the ways to subsidize care at a lower cost. But it's difficult sometimes navigating these new plans. Going from, let's say, a Kaiser to a Health Net to a Blue Cross, they have different ways of doing things, and that gets complicated. And that's something that, if you're not used to it, it could become difficult. And as well as the costs. Most of the time, as an employee, your employer's paying most of your costs. And so the fact that you have to come out and pay $500, $600, $700 a month, it's not insurmountable if you put together your plan, but it's something that you have to plan for and you have to be ready for. And, for those of us that are in the US, what's your biggest worry about healthcare and retirement? I see it coming up a lot in the comments, and I'm really interested in understanding for you, what's your biggest concern about retirement?